Hello, warm welcome to everyone. Dr. Vijay here. In this video series, we are going to take look at different renal function tests. Today we will focus only on part 1, that is classifications of renal function test. As you all know, our kidney play a vital role in the excretion of waste products, regulation of water and electrolyte balance, and maintaining acid-base balance, and production of certain hormone like erythropoietin, and also activation of vitamin D, which takes place in the kidney. So, renal function tests or kidney function tests are essential for diagnosis, prognosis, monitoring the treatment of different renal diseases. Let's study about classifications of renal function test. So usually renal function tests are group of tests that may be performed together to assess functions of the kidney. Among these tests, we can group in different categories. First, certain tests done in the urine. So after collecting the urine, we can do some test that comes under urine analysis. The second group, the most important tests which are done after collecting the blood sample. The last group of tests which help clinician to diagnose various renal diseases, that is imaging techniques or radiological test. So we will see these test classifications or group of classifications one by one. First we will see what are the tests done under urine or examination of the urine. So, urine analysis could be grouped under three categories of test. The physical characteristics of the urine, that is physical test, and test done in the laboratory, that is chemical test, and also we can do certain tests or we can study the urine under microscope. So that is microscopic examination. Under physical test, after collecting the urine, we can see the appearance, color, odor or smell, volume of the urine, specific gravity and pH. These tests are grouped under physical characteristics of the urine or appearance of the urine. Under chemical test, we can do qualitative, semi-quantitative and quantitative examination of some of the parameters. So the most important or essential parameters are glucose in the urine, protein, ketone bodies, blood, bile salts, bile pigments. All these tests could be done qualitatively, like using chemical reagents or using dipstick method, or we can do quantitative estimation as well. Under microscopy, we can assess the presence of red blood cells, white blood cells, pus cells, different types of casts and crystals. So all these urine analysis parameters will give a clue about the diagnosis of various renal disorders. So this video is just an overview or introduction about different classification. So in the coming video, I will discuss a detailed view of all these parameters. Blood test, this is the most important test to diagnose various renal diseases for the clinicians. Most routine blood tests are serum urea, serum creatinine and glomerular filtration rate, or popularly known as GFR. And under GFR, again there are different tests like clearance test, creatinine clearance test. Apart from these, we also have certain ratio like albumin creatinine ratio, So we will discuss all these tests under blood test in separate video. So urea, creatinine and GFR are the routine tests to diagnose various renal disorders. Even though I have written here blood test, for GFR estimation we also require collection of the urine to note down the volume and other parameters, which we are going to study in the separate video. Sometimes we might require some rare tests in order to diagnose various renal disorders like anti-neutrophil cytoplasmic antibodies. So these are autoantibodies we can detect in the blood by doing immunofixation or ELISA technique to diagnose some of the disease, which we will discuss later. And sometimes we might need to estimate complement levels. Certain complement levels also help in diagnosis and monitoring of the various renal disorders. The last categories of renal function tests are radiological tests or imaging techniques. First and foremost is X-ray, just plain X-ray. Here with the using X-ray we can detect various stones, renal stones. It could be in the pelvis or ureter or bladder. The next imaging technique most useful is USG or ultrasound or ultrasonography, which is safe and non-invasive technique which detect size of the kidneys, whether it is enlarged as in case of hydronephrosis or sometimes it is shrink. And we could also study about the obstructions in the bladder, in the ureter and even sometimes in the pelvis of the kidney due to various stones. So modification of this USG, that is Doppler ultrasonography, could be used to assess renal vessel patency. The next imaging technique is computed tomography or popularly known as CT, which is somewhat invasive, produce little amount of radiation but helpful in staging various malignancies. Also it is useful for visualizing arteries. Modification of this CT scan, again we can use PET scan, that is positron emission tomography, to diagnose various disorders. The next category of radiological test, magnetic resonance imaging or MRI. It could be used as an alternative to CT scan because which is a non-invasive technique with no radiation. Another category of radiological tests is called antegrade pyelography, which is an ultrasound guided injection of contrast medium to the cavity of the kidney called calyx, which is located in the pelvis, to study functions of the kidney. The next category of radiological test is called micturating cystourethropy. As the name suggests, here contrast medium introduced into the bladder through catheterization, then catheter is removed, then X-ray is done during micturition or while passing the urine. This is done usually in children to check vesico-ureteric reflex and emptying of the bladder. Next radiological imaging technique is called renal arteriography, or sometimes we can call it as iotography, to study renal artery stenosis. This test involves X-ray imaging after injecting contrast dye. Renal scintigraphy. This test uses labeled isotopic studies to study renal perfusion and renal secretion functions. Last category of radiological test is called transcutaneous renal biopsy, which is again ultrasound guided biopsy to study the renal disorders like nephrotic syndrome, acute and chronic kidney diseases. So these are important renal function test or kidney function test to assess clinically different renal disorders. So in the coming videos, the part 2, I will be discussing exclusively about urine analysis, and part 3 we will discuss only blood test including GFR.